A lot of news as we get to it this Friday. A teenager we've learned has died from COVID-related multi-system inflammatory syndrome in children. It's also called MIS-C. And today, health leaders gave an update on the new South African variant COVID-19 in South Carolina. We kick it off with our Ann Maxwell. She is the latest now on the state's pandemic response.
Health officials say a spike in COVID cases could mean more cases of MIS-C as well. Meanwhile, Dr. Fauci says the South Africa variant now found in South Carolina is concerning for the pandemic overall. With a high number of cases in the state, at least 42 South Carolina children have been diagnosed with MIS-C, a rare health condition that affects children and teens who have been exposed to COVID-19. Now, a 17-year-old from the Upstate has died in the first reported MIS-C fatality in the state.
This is very heavy on our hearts today as pediatric providers.
Pediatric infectious disease specialist Dr. Anna Catherine Birch says MIS-C symptoms usually appear 2 to 3 weeks after a child is infected with COVID-19. Signs include fever, flu-like symptoms, and red eyes.
Typically, though, we are followed behind a surge of increase of COVID cases by 2 to 3 weeks, and sometimes even 4 weeks with a diagnosis of MIS-C. So it does not shock me that we are currently seeing more cases of MIS-C at this time.
With vaccines providing hope across the state, another threat has surfaced, a more contagious virus variant that was first identified in South Africa. DHEC reports 2 cases have been identified in South Carolinians, one from the Low Country and another from the PD region. It's not believed to make people sicker, but it does appear to be more contagious. DHEC officials say not every COVID-19 positive sample is being sequenced to determine if it's a variant strand.
That is a much more intricate test that is more time consuming. And so random samples are chosen.
The Washington Post reports South Africa saw its biggest spike in cases and deaths in the 6 weeks since the new variant was reported.
Certainly with it being more transmissible, there is the potential that we could see higher increases. But we are doing everything we can with the CDC's help to stop, as I said, any continued spread of it.
Moderna says it's in the process of creating a booster shot to fight the South Africa variant as well. In Greenville, Ann Maxwell, 7 News.
DHEC has also opened a new COVID vaccine information line. It is available from 7 a.m. to 7 p.m. 7 days a week. That number right there on your screen, 1-866-365-8110.